Now to health matters. How well do you know your HIV/AIDS status? The Lagos State government, in ensuring more residents are aware of their status, has presented 5-year findings on how to address the epidemic through more funds, adequate environment, early treatment, among others. WACPHD has more on this report.
HIV and my health status. Because I don't go for checkup. I just live life as normal, no money, they say somebody was sick, now they find doctor go. Me, I no sick, so I don't know, I never go for checkup, so I'm just living,
Randomly get tested. Not something that has to be contacted through sex alone. I mean, you can just go to the salon and just get pierced through the skin by the salon, the hairstylist accidentally and all. So I feel like it's a necessity, something that should be done at every point in time. Yeah.
I know it. I'm negative.
Okay. How do you know it, sir?
I've been tested and I find out that I'm free.
I don't know my HIV and its status, but I don't think. On assumption, I believe I don't live a world life, so I don't know where I can get it from.
While some residents believe in a regular checkup, others are of the opinion that there is no need, as they do not live a wayward lifestyle. In the Ikeja area of Lagos State, the Lagos State AIDS Control Agency, along with some partners, held an assessment of how Nigeria and Lagos has contributed to reducing the rate of HIV/AIDS in the country and how viable the treatments are.
In terms of optimizing available resources, you need to identify who are the people who need these services most and ensure that you target the available resources to them. This is the thing that is done everywhere in the world. You cannot meet the need of every individual who need the services, but you need to prioritize and ensure that those, especially the vulnerable ones, who do not have the resources to be able to access this care on their own.
The best, cheapest and most effective preventive effort the common man can do is to abstain. It doesn't cost you anything to abstain. What it costs you is self-discipline. If the government understands how much investment they are putting into prevent AIDS, to manage all the issues that come with HIV and AIDS, they'll be in a better position to determine where the gaps are and then how to plug the gaps.
While there is commendation towards the government on their contributions, there is still need for more financial commitment to HIV control through improved budget appropriation and the release of appropriated funds.
Prevalence definitely has reduced because of the interventions over the last 15 to 20 years, because there have been a lot of response, and even the current medications that people are on help. If you have been consistent on treatment for 3 to 6 months, the efficacy of transmission of new infection is less because you achieve viral suppression, and then new infections are reduced to the barest minimum.
There are so many myths that there is no more HIV. There is still HIV, and we need to go out there, check our HIV status in order to know that yes, I'm either positive or negative. And even if you are positive, it's not the end of the world. HIV is no longer a death sentence. It's just another disease that we are now managing, even there is no cure for now. It's really, government is really doing well, and we also hope that we get more funding and more support from the state government, from the international organization, at the same time the private sector, in order to reduce out-of-pocket funding from the people living with HIV/AIDS.
All important documents. As more Nigerians feel the brunt of the current inflation, these stakeholders say there is need for more advocacy to ensure persons affected receive early treatment, while others take the prevention route. In WACPHD, TVC News, Lagos.